Hi, welcome to BioBalance Healthcast. I'm Dr. Kathy Maupin.
And I'm Brett Newcomb. And today we're going to talk about depression. Depression is, as Kathy and I have our conversations, we discovered that there's incredible amounts of overlap between our two fields. And depression is one of those areas that overlaps pretty significantly. In my field, when I have somebody come in that presents with all of the symptoms of depression, one of the first things that I have learned to do is send them to a doctor. I want them to go to a medical professional, not a psychological professional, to be evaluated for health-related causes. My training teaches me that there are two kinds of depression from which people suffer, what we call endogenous depression, which is a physical system malfunction, usually having to do with neurotransmitters in the brain, and Kathy will speak to those concepts in a minute. And the other is called an exogenous depression, which is an externally caused depression, like your dog dies, you lose your job, your kid moves away to college, any number of things that happen that make people depressed. And the way that I understand it is if you set an upper range and a lower range for mood swings, emotional changes and fluctuations in the course of a day. Everybody fluctuates. We all go up and down. Most people don't go above or below a certain point. And if you have clinical depression, you go way below that point.
Right.
So sometimes you have an exogenous depression and you are seriously depressed, but not what we would call clinically depressed.
And tell them what the difference in that is.
The difference is the severity and duration of the depressive cycle. They don't cycle normally. So you can be knocked off your feet for a few days, maybe even a couple of weeks, not really that much of a concern. But if it becomes a constant problem and an enduring problem, then you start to have what we call clinical depression. Part of the challenge with that is that many physicians now, when a patient goes to them and says, this happened and I'm depressed, they say, well, here, take some antidepressants. So we want to talk about antidepressants, and in another podcast we'll talk about anti-anxieties, which are dispensed in a similar way. Here's an antidepressant and an anti-anxiety, mix them as you need them.
Part of that, to the defense of physicians, because of the way HMOs, managed care, has dealt with us,
yes,
we have a very short period of time, and an evaluation of depression is multiple hour-long conversations with a counselor, psychologist, or psychiatrist. So it takes a lot longer than what we have available in the office. And so
I'm
that's
glad
a
you
shortcut.
clarified it, and because I don't mean to be critical about that's just the way that it works.
And it's not a bad idea to see if it works. Sometimes
and it may be beneficial to
that
take
works.
it for a week or so to get you over a hump, and then you're all right. But the way that I understand it, what I wanted to say was sometimes exogenous depressions, external events, are so impactful that they do become enduring and they lead to an endogenous change. So your neurotransmitters can change because genetically there's an imbalance, or they can change because some external factor, some compilation of stress or loss over an extended period of time.
I kind of like to view it as a genetic weakness to that. If you look in your family history and you either know that your family members, there were several that had honest-to-God depression where they were either hospitalized in the old days, that's what we did with patients, they were hospitalized, and then or took some other medication. If
alcohol. They were hospitalized for alcoholism because they were depressed.
That's right. They were doing something like that to feel better. And it doesn't make you feel better, of course, but it feels good at the time. So many, if you look at your family history, that shows a genetic weakness that you might have.
Actually,
Okay.
you said something that so many people say. They said they were drinking to feel better. That is not what the data shows. They drink to stop the pain.
Oh,
the drinking doesn't make them feel better, but the loss of the numbness or the hurt makes them feel like they feel better.
Oh, okay.
But
I didn't really realize that was this.
Well, nobody cares except people in my field, and they'll fight about it forever. So what we want to talk about today are the symptoms of depression, what to do about depression. Sometimes the treatment for depression takes both medicine and therapy, and we want to try to give some people information that would be useful in considering if they are depressed or if they're with someone who is depressed. One of the problems with people that are depressed is that people don't have a lot of patience with them. It's not an acute problem like you broke your arm and everybody can see it and they go, oh, you poor baby, you broke your arm. After a little while, nobody has patience with that depression. They're like, damn it, get over it. You know, I'm tired of this. Where's my dinner? You know,
Yeah.
how come you haven't cleaned the house? What? We never go anywhere. We never do anything.
Why
You're
don't
a
you
slug.
smile anymore?
Yeah, you weren't like that when I married you. You know, did you lie to me? And I mean, they get really.
That's true. That's what my
it's just
patients tell me.
horrific. Yeah, and so if you are the sufferer of the depression, you look at that and you say, I'm helpless here, because one of the characteristics is I feel hopeless. I feel like there's not ever going to be a ray of sunshine again. I have no energy. I go sit in the corner, and I just am flat.
And if you're a female, you talk to your friends over and over and over again about how bad you feel, but you don't really want a way out, because depression makes you not want a way out. It makes you want to kind of wallow in it. And friends don't have a lot of patience for that either, because it makes them feel depressed themselves. And no one wants to feel depressed when they're talking to their friend.
I wrote about that in my latest blog at brettnewcomb.com. The impact on the therapist. I've worked with some people that are really chronically depressed, and over time what I began to notice is it was really hard for me to have the energy to go in the room and sit and listen to the same despair. I mean, it's you have to really teach
It's
yourself
contagious.
how to handle that.
And it actually, I've noticed, because I've had to do the same thing in OBGYN, we have relationships with our patients, and they come in and they tell us about how depressed they are, how horrible their life was, and for a year they felt terrible, and they tell us everything. And then I felt like I was taking on their pain and their depression, and then they leave and feel better. It was like they transferred it to me, and I'd have to walk out of the room and kind of breathe deeply and try to
Absolutely.
get that mood off of me, because I can't walk in and be depressing to a patient, another patient.
No,
That's not fair.
You can't. And so one of the things that happens, and therapists are trained, some patients are so energy negative and needy that they will come in and it's like you're a rechargeable battery. And they will plug into your energy and they will absorb it, and they'll feel better when they leave the session. And then you realize as soon as they leave that you are depleted. And if that consistently happens with the same client, then you have to learn how to protect yourself from that. You have to learn how to filter that process so that you can still give them energy, but still have some at the end of the session.
And moreover, get them out of that cycle of just talking about it.
Absolutely.
Of maybe they do need medicine, maybe they need...
Nice segue, because we need to talk about
That's right.
the science of that.
Yeah, we need to talk about that. Because depression, in my world, it can come from hormones. It can come from long-term stress, which is mediated by a hormone called cortisol. And when your cortisol goes up for a long period of time, it wears out your neurotransmitters. Your serotonin, and I'm sure you've heard of these, serotonin and epinephrine are the two most important in depression, and it wears your brain out. So when you're trying to survive a long-term stress, and many of us are surviving long-term stresses years long in this economy, and there are so many other things that are happening that cause us to be chronically stressed. Finally, you run out of neurotransmitters, you get depressed, and you feel depressed every day, every minute, and you just can't get out of it without some help, and that would be medication that would replenish your neurotransmitters. And I also usually use something to decrease the cortisol, because that messes your sleep up. If your cortisol is high all the time, you wake up at 2 o'clock in the morning and ruminate and worry, and that's usually a cortisol issue. So I use a very low dose of a natural cortisol from animals, an animal cortisol, but it's very low dose, and it decreases that big spike in the middle of the night and helps you sleep.
But it's important that you talk to your physician about your symptoms, because one of the frustrating parts about depression is that it manifests in the extremes. And so some people adapt by sleeping all the time. I mean, every minute they're not required to function, they're asleep. Some people adapt by not sleeping at all. And so they'll report, I can't sleep, or I can fall asleep, but I can't stay asleep. The same thing happens with food. Some people, when they're depressed, cannot eat. And you worry about their survival because they're not eating enough. And other people, when they're depressed, eat all the time. So it isn't that you can say, oh, do you have a sleep problem? Do you have a food ingestion problem? You have to look at the duration and the extremity. If you're swinging to the far side of either of those things, then you need to talk to your doctor about the fact, I'm doing this, help me.
And how long it's been. It's best to be armored with your history. Go in and say, okay, so it's been 6 months and I can't get out of this mood, and here's what my husband says about me. Yeah.
You need a keeper that will come and say, she's been this way for 4 months, because she's going to sit there and go, I
Bring your
have?
family.
I have?
Yeah. Was it that long?
Was it that? I don't remember, because when that flat affect and that depression exists, you lose track of time. So sometimes, though, you get a patient that comes in, you go through all this process with them, and you say, you know what, I think you need an antidepressant. Try this one, or an anti-anxiety. Then that person will call me and say, my doctor gave me this medicine, but I don't want to take it. And
Because they're afraid of it. They're afraid they'll be hooked on it forever, but that's not what happens.
or they're afraid of side effects.
No, that's true, and there are some side effects to these, but in general, we can't change the brand or change the type if there's a side effect. And the risk of being hooked on this, if you're only using it for, especially anti-anxiety agents, those are the only ones that could be something that you would get hooked on.
The addictive factor,
yeah.
not the antidepressant, but the
Antidepressants
anti-anxiety.
don't do that.
But the antidepressant, many of the antidepressants that are out there have a side effect of reducing libido,
Right, and
which
then,
makes it a catch-22, because if you reduce your libido and you're non-responsive, non-aroused, non-sexual, then you're going to have pressure from your partner who suddenly says, do you not love me anymore? Have you found someone else? Is there something wrong with me? Am I doing something wrong? Which isn't the cause. Or they'll get angry. You never initiate, you never it's a problem. And so when I have an individual who's taking one of these antidepressants, I really talk to them and to the couple about this potential side effect. It doesn't happen immediately. It happens over time. It's like continental drift, plate technology, tectonics. So I talk to them about recognizing the symptom and understanding when it happens. Somebody has to cognitively process, and it's not the depressed person.
yeah,
Has
it
to
has to be
cognitively
somebody who loves
process,
you.
this is the side effect of the depression. This is not a definition of our relationship.
And then the person that's taking the criticism has to realize that their loved one is trying to help them. They're
Yeah.
not trying to be more critical and make them feel worse about themselves.
And feel more hopeless. I'm trapped, I can't do anything about it.
Most of my patients say, well, I can either have sex or I can be happy.
Yeah.
That's basically the issue. And now that I deal with women over 40 most of the time, men over 50, that is a hormonal issue.
It is,
that
and if you're
causes
having
depression.
sex or be happy, and so you have sex in order to be safe, then what happens is that becomes toxic. And there's a build-up for that, because I'm not having sex for intimacy, I'm not having sex for desire, I'm not having sex for relief, I'm having sex for safety. And that feels like a form of prostitution or abuse. And so you get resentful and you feel trapped. And it's not understanding these things and not finding compensatory strategies that work for your situation really leads to additional problems, and it's part of the ancillary cost of being chronically depressed, clinically depressed. What often happens with the sexual piece of the antidepressant medicine is that the person that's taking the antidepressant will not feel desire. They won't be conscious of, oh, I haven't had sex in a while, or oh, I want to have sex. Chemically, it's just not there.
It's true.
So they can, however, respond if someone else starts the dance. So if their partner will come to them and say, hey, I want to be sexual, however they communicate that, you can respond, but you won't initiate. There's another kicker. Sometimes you can respond, and then all of a sudden, in the middle of the act, boom, it all turns off. And you're like,
And that's disconcerting to the partner.
oh my
by
gosh,
a
it's
lot.
devastating. So if you don't know that, and you don't understand that, and you don't develop strategies for working around it, you are going to compound the problem.
Being able to have expectations that are
Anticipate.
realistic
Yes.
is kind of the key to every treatment. No treatment is fun. No treatment is without side effects. No answer to a problem is usually without risk. So all of those things, if you know those things, then you can decide whether you want to take that risk or not.
Right.
Is it important to you to not be depressed?
Well, we're back to being an informed consumer. And one of the informed consumer tidbits is that your family, your support personnel, your coworkers, somebody needs to be aware and participate.
Somebody you feel safe with. Somebody
Yeah.
you don't feel threatened by Because if you've always had a relationship with your spouse where they're criticizing everything you do, that's not the person to tell you that you're
Right.
starting to act depressed again.
Maybe a sister, maybe a next-door neighbor.
Best friend.
Maybe even a grown child, somebody that might know. The problems of depression are many and manifest. Books have been written. We're not going to cover all of that today. But I guess the key points would be, know that there can be a physiological component, there can be an emotional stress component. They interweave for what we call clinical enduring depression. You have to have some kind of intervention. Go talk to a specialist, talk to your physician, talk to a counselor, get some help.
And I'd like to talk about on our next HealthCast about the hormonal reasons to be depressed and anxious. And that we didn't get to cover today.
We'll
just for
start
time.
with that on the next
and
one.
so we'll start with that on the next
So
one.
tune in next time, and thank
Yeah.
you for watching today or listening.
And if you have any other questions about our HealthCast, you can go to our website, biobalancehealth.com, or you can send us an email at podcast@biobalancehealth.com.
And you can find me at brettnewcomb.com, and my latest blog is about depression and anxiety.